as I was saying, the I haven't made any vlogs since I started the alternate treatment because, um, quite frankly, I I didn't know how it was going to turn out, and I couldn't take all the camera and lighting and stuff down there with me, and um, when I got back last time, I was busy setting up all my nursing stations and um, just waiting for the first MRI to confirm, the first Toronto MRI to confirm what the what progress I had made, um, and that was my deciding factor. It's like, okay, well, um, the doctors here are pissed off. At that point, I had uh, by the time they got around to analyzing the Toronto MRI, it was almost a tumor reduction of almost 50%, and um, uh, the doctors in Mexico had said 30. There was a few weeks in between the two, maybe about a month between the two MRIs, and so there was the thrill of, having made progress, and that it actually seemed to be working, and so there was no time really to for this kind of introspection, um, and is one thing I'm finding now that I'm back from my second visit. I am talking to friends and family, and I'm telling them that it seems I'm making progress, and all along I felt that it was working. I just knew I knew that I was going to have to go through a long period of time of not feeling good. But when people are excited to hear that I'm doing well, go figure. Um, the but what when they ask me about the treatments, and what they are most surprised about are the vaccines. Um, Most people don't know anything about the vaccines. There's a lot of within the cancer um, specialization. There's a lot of experiments, clinical trials going on in the world with cancer vaccines, and yet none of my acquaintances or family were aware of them. And it seems that this is what is really unique. They're doing stem cells down there. Like some of the cancer patients are receiving stem cell therapy. Um, the more that I see down at this clinic, the more I realize that this is the cutting edge of medicine. And I don't understand why it's being withheld from the from the public at large. It's from what I've read online, there's a cancer conspiracy theory that the, the current paradigm would collapse and the pharmaceutical companies wouldn't be able to make any money if it moved to vaccines. And I don't know. Well, I do know why, because they're trying to make a one-size-fits-all vaccine, and they're hitting, and it's not working out because you can't do that kind of thing with this. You only get results. I can't say that. You get a better result if the vaccines are personalized and customized. And there's, I don't see why I don't see why that the medical industry should be allowed to get away with withholding treatment. I'm going to stop short of saying the word murder, but it's a changing world. Just as an analogy, the internet has turned the publishing world, the music industry, and everything else upside down. Put people out of work and it's changing that, or it's changed those industries. So I don't see why the governments are letting the pharmaceutical industry get away with blocking the use of stem cells and vaccines. In all fairness, there are some vaccines that have gone through and been approved for use, but it's just it's such an onerous process. The ones that I, on paper, qualified for, only to have my find out after they analyzed my tumor slides that I didn't have the one-size-fit-all marker or antigen. It takes a lot of nerve, gumption to do what I'm doing. I only wish that I had been presented with these options earlier. I don't think I would have done the radiation to the brain. If I had known about, although low dose radiation, whatever low dose is part of the treatment at the Mexican hospital. But of course, there's just all this pressure to get you into the mainstream of treatment, and to hell with giving you any options. Um, the people at Princess Margaret Hospital have been brainwashed. At least the ones that I've been dealing with. Um, there's usually a long wait to see the doctor, and a few weeks ago there was a student who was doing a survey, and her eyes just opened like in response to some of my answers to her questions. She was astounded to discover that the ownership rights of tissue that's cut out of you, and the bureaucracy that goes along with that. She hadn't been taught that. This is one of those little things that they keep from the students. And her, at the end of the day, her question was, would I consent to additional surgery, which is not possible at this point, because the tumors they're inoperable. If it was discovered, and I know it has been discovered, that when cancer tissue grows back, that the markers or the antigens, the genetic makeup of them morph. They're not quite the same. It's more a case with cancers other than primary brain cancers that can move around the body. So if you have pancreatic cancer and it metastasizes to the brain, it could have a different, makeup, genetic makeup. And whether I would, in a circumstance like that, I would consent to having surgery to get a sample of the tumor, because ostensibly it could affect the treatment in a positive way. I'm not sure how, though. If they're not going down the road with vaccines, and it's that part of the survey was not clear to me. But anyways, it's a hypothetical at this point. What I do need to find out is, do I have enough tumor slides banked to give me another 40 years of vaccines, because I'll be taking them, I think either once a month for the rest of my life, or once a year, or something like that. So